Welcome back to our section on physiological strategies to enhance performance, and we will be looking at strategies used in recovery such as the use of ice, heat, compression, hyperbaric chambers, massage and sleep, and you need to be able to compare and contrast these different strategies. And we were participating in some of them in class. So physiological strategies that promote recovery, they target functions of the human body that are stressed during exercise, and we try and counteract that. We try and counteract those causes of fatigue and promote recovery. Benefits of physiological recovery strategies are that it allows us to maintain our optimal intensity during consecutive training sessions. It also enables us to achieve optimal performance during competition. We also can have training adaptations, those chronic adaptations accelerated by these physiological recovery strategies. It also enables us to manage fatigue between training sessions and helps to minimise the risk of overtraining. So if we have a look, rest and sleep is the first one that we're going to look at, and in fact it's viewed by coaches and elite athletes to be the single most important recovery strategy. And generally speaking, most people need about 7 to 9 hours a night, and that allows for the most optimal amount of recovery. And if you look at what happens with different sports, such as road cyclists, so basically they perform aerobic activity, and if they don't get enough sleep, it involves, they can suffer from an increased number of errors. If those involved in team sports, so they've got to have high concentration, moderately aerobic, they can suffer from a decrease in decision making if they do not get enough sleep. Runners, approximately 3,000 metre runners, swimmers, approximately 400 metres, have found to have marginal effect on their performance due to lack of sleep, whereas those in middle distance running and swimmers have reported to have decreased power from lack of sleep. Anaerobic sprinters and power event athletes have been shown to have marginal effect because of sleep, probably because of the short duration. Whereas those who are engage in repeated anaerobic efforts, such as jumping events, weight training and so on, have reported to have an increase in fatigue. So the benefits of sleep are they enhance focus. They also optimise information processing rates, so your ability to process information and take up that information. It also optimises functioning of the immune system. Our immune system recovers and is enhanced by having adequate amounts of sleep. It helps us to control our emotions, less likely to be irritable. It also maximises our memory, which is important when athletes are autonomous learners. They have those memory, skills engaged in memory. It also delays feelings of fatigue. So one of the recovery strategies we're going to look at is hydrotherapy, which is basically the use of water submersion techniques. And it's found to have a compressive effect on the body by immersing yourself in water. And it's been found to have these following benefits. So there's an increase in the transport of oxygen and fuels in the blood. It also has been found to increase cardiac output as well as reduce peripheral resistance. So hydrotherapy's been found to be most effective in the early stages, immediately after recovery, and when they're required to undergo subsequent exercise sessions within 24 hours. So it's really good for them, when they've got to back it up with competition the following day. It can really help with their recovery. Cold water immersion, CWI is how we see it recorded as, involves immersing the body in ice baths, or they could be in large bins, containers filled with ice, but basically the water temperature is about anywhere between 6 and 15 degrees. And what it does is vasoconstriction of the blood vessels. This has an effect of being able to reduce inflammation. It also decreases skin temperature as well as muscle temperature. It also decreases pain. It also enhances the perception of recovery. People feel that they recover better. It also decreases metabolism, which slows down our physiological processes. in tissue breakdown. It also decreases heart rate after high intensity exercise in the heat, which is very advantageous. And it can also reduce the symptoms of DOMS, which is known as delayed onset of muscle soreness, when you get that real feeling of muscle soreness a day or two after competition. Beach or pool sessions are also known to use cold water immersion, provided that the water temperature is within that recommended range. And you often see football players, netball players, after a game go down to the beach and engage themselves in a beach session where they're immersing themselves in cold water for those benefits. There's also been found to be an advantage of using salt water at the beach compared to the pool, as salt water has a greater density than normal water, so therefore it actually acts as a compression force. So it compresses those blood vessels, enabling greater recovery. Ice treatment is referring to the use of ice. It's fairly obvious for therapy or recovery. And it's also got another name. You may have heard of it being referred to as cryotherapy, which is the use of ice. And it's used for the following benefits. It decreases temperature, dulls the sensation of pain, reduces swelling, minimises internal bleeding, which is important with injury. It reduces the incidence of muscle spasm and decreases muscle soreness. So you'll notice that that's very similar to cold water immersion. Many of those benefits double up. Whereas HWI, or hot water immersion, that involves immersing the body in a spa or a hot bath. Some athletes use it at the end of a day or a rest day as a relaxation technique, but generally speaking, they wouldn't want to do that after a day of competition, because generally speaking, there'll be those micro traumas and they're more likely to benefit from cold water immersion rather than hot water immersion. Hot water immersion is it's obviously the use of hot water, but it shouldn't exceed 38 degrees Celsius. And instead of vasoconstriction, it causes vasodilation of the capillaries, and that of course increases your blood flow, which increases your supply of oxygen as well as antibodies to the muscle. It enhances your ability to clear waste products. It also enhances the muscle elasticity, so it makes them more readily able to contract and reduces that muscle stiffness so that we're able to get greater flexibility. And we're also able to reduce the effect of delayed onset of muscle soreness. So it can reduce that real feeling of muscle soreness a day or two after the competition and reduces the incidence of muscle spasms. Whereas contrast water therapy, CWT, is immersing themselves in alternating hot and cold water. And it's been found, the combined effects of using hot and cold water appear to have a greater benefit than using cold water immersion in isolation or hot water immersion in isolation. The reason being is it creates this pumping effect by alternating vasoconstriction and vasodilation. So our blood vessels, our arteries, our capillaries, our veins are dramatically constricting, getting smaller, and then rapidly dilating, getting bigger. So it creates that pumping effect, which therefore enables greater clearance of waste products, decreases swelling, stiffness and pain, reduces inflammation, has been found to increase range of motion, decrease muscle spasms and soreness, can stimulate the central nervous system, decrease post-exercise blood lactate levels because of that increase in clearance of waste products, and it also helps people have a greater sense of well-being. So generally speaking, this is how a hydrotherapy contrast water therapy protocol would look. So they would shower before use, and then they would do 2 minutes in the spa. Mind you, you'll notice there at 39 degrees Celsius, probably a bit hot, probably wouldn't want to be any hotter than 38 degrees Celsius. Then they would go, after 2 minutes, they'd go for 1 minute in the plunge pool between 12 and 14, but they can afford to go even colder than that and repeat 4 or 5 times. Whereas if they're in the shower, they can alternate warm to hot water, whatever feels comfortable, for 30 to 60 seconds, then turn it on cold for 30 to 60 seconds and repeat about 5 times. Also compression, I mentioned that earlier. Compression garments are worn by people because they exert a compression gradient between the skin and the garment. So what that means is they are able to compress or reduce, putting greater pressure between, on the skin. So what happens is it can increase blood flow. It's putting pressure on those blood vessels to increase blood flow back up to the heart and encourage greater removal of waste from the muscle back up to the heart. It's been found to reduce venous pooling or pooling of blood in the veins, so that compression, that pushing on those blood vessels helps push that blood back up to the heart. It's also been found to reduce muscle swelling, and it's also been found to reduce oscillations, which are basically vibrations of the muscle. So making sure that the muscle, there's less vibration, so there's less wasted energy, and this can reduce muscle tears, and also compression garments have been found to decrease the severity of delayed onset of muscle soreness. So here we can see here people wearing their compression garments. Massage therapy involves manipulation of the body tissue through applying pressure, either manually or through the use of mechanical aids. And its benefits have been found to increase the sense of well-being. People feel more relaxed. It can help reduce anxiety, which is really important for athletes. It can aid to prevent and maintain injury. It can also help with pain relief. Once people work in, remember that you've got relaxation massage, but you've also got rehabilitation massage. So people really getting into those muscles and reducing stiffness and soreness and tightness, which can decrease pain. It can increase blood flow, reduce muscle tension, cause temporary decreases in heart rate and blood pressure because of that feeling of decreases in anxiety. And it can increase muscle temperature if they want to increase muscle temperature prior to going out and competing. If it helps relax them and increase blood flow prior to competing by that heat generated with manipulation. Hyperbaric oxygen therapy is the use of oxygen at a higher level than what oxygen is in the atmosphere, and that's to increase the amount of oxygen available in the blood plasma, which is then taken to the muscles. And that's thought to enhance the immune system. So people go in when they're injured. So you can see someone here in a hyperbaric oxygen therapy construction, and basically they tend to use it to try and increase their recovery from injury because of the higher levels of oxygen. It also, some people find that it increases endurance. It increases the removal of waste products by detoxifying the blood, by increasing the amount of oxygen in the blood. It can help athletes feel relaxed, calmer. It can heighten concentration, alertness, and memory. It has been found to lessen the impact of altitude discomfort. When people go up to altitude, there's less oxygen available in the air. So if they go into a hyperbaric oxygen chamber, there's greater amounts of oxygen available. So that combats that reduction of oxygen in the air. It also can help reduce fatigue and enhance sleeping patterns, reduce muscle stiffness, and improve recovery after physical exercise. And other strategies that have been used, ice vests have been used during breaks in play in interchange situations to try and reduce muscle temperature and decrease the effects of dehydration causing fatigue and causing a reduction in performance. Some athletes are known to go in refrigerated cool rooms during long breaks in play when players are taken from the field for the same reasons. Some teams have been known to use ventilation or fans on the side of the playing venue so that it can help them cool down their muscle temperature and make the most of protective shade, using either natural shade or surrounding buildings to try and once again keep down their muscle temperature. So here we can see special fabrics that actually help remove the moisture as well for faster evaporation. So we have reduced or modified clothing to avoid overheating. So it should be loose fitting, should be lightweight, light coloured clothing should be worn. But also you can see here that the way in which the fibres are created in this type of clothing enables greater heat loss.